Samuel is from Barcelona. He's one of my students in AP therapy, and he did wonderful work there in Spain with Beehive Air too. And he has a very nice story. So I'll translate because Samuel asked me to do the translation. He's not speaking so well English for the time being. For the next conferences, he will speak very well English, I'm sure. So here is his short story. In the year 2006, he had an accident, traffic accident, and then he got 7 operations, and he was in the hospital. He was having huge pains in the leg, in the right leg, the calf, and the conventional medicine, allopathic medicine, has not been able to relieve his pains. So he understood that there is epitherapy possible to be used. So he had this kind of treatments here, and finally he came to the idea to create this bee house. You see here, very nice with the hexagons. In a clean environment outside Barcelona. And here is he saying how it's working, the system. So there are volatile components which are going to the bloodstream through the bronchia, through the alveoli, in about 10 minutes after inhalations. And it's no need here for digesting because you just take the volatiles directly into the lungs through into the bloodstream through the lungs. Okay, the properties of the bee products he mentioned very well are degraded in time by oxidation, by temperature, high temperature, or by light, solar radiation, by ultraviolets or by infrared also. So you need to keep these bee products at the distance of such negative factors. Okay, and in the Beehive Air, we find substances which cannot be found in the other bee products. And in the other bee products, for example, propolis can be too old, or honey may be sometimes fermented, or royal jelly is not good enough. But in the Beehive Air, it's everything fresh, very fresh, because you just go there to the beehive. It's no storage. There is a system of storage in the Beehive Air, but it's another topic. Okay, and also a very good point from Samuel is with this system, with the Beehive Air Therapy, we take advantage of these components from the beehive without damaging the bees, without disturbing the bees in a direct manner. Like when you want to get the bee venom from the beehive, you must use those bee venom collectors, which is very stressing for the bees. Here, if the technique is well done and soft, then the bees are not disturbed. Okay, you see here also very nice images. Here, patient relaxed also. It's not standing, but it's still a good position also for the breathing. Maybe like Dr. Zorica said, if it's a breathing problems, the patient should stand a bit more like vertical here. You see here the bees through this glass. So this is also good for education, api education. Some herbs here, which improve the volatiles in the cabin. So you can use aromatic herbs specific to the problems of the patient. It's a good idea. Okay. Okay, so we know that in the beehive we have a lot of bee products very good, like propolis, royal jelly, larvae from the bees, bee larvae, drone larvae, and so on. Okay, and he mentioned here a few families of substances which can be found in the air, like terpenes, acids, carboxylic acids, cetones, aldehydes. There are over 100 substances, volatile substances in the beehive air. And we didn't find any toxic component or a damaging component for the health as for the time being. Okay, okay. Now here is Samuel. ¿Tienes aquí? Es una lista.
Aquí hicimos una prueba con la universidad para comprobar qué compuestos orgánicos había, qué compuestos volátiles.
Okay, con la Universidad de Barcelona, ¿sí?
La Universidad de Barcelona analizó con el control de gases y analicemos los compuestos que había.
Okay, muy bien. Here was a test done by the university from Barcelona. They analyzed the air. You see here the analyzer, the sensors. They took the air from the beehive and they analyzed it in the university.
Analicemos dentro de la colmena y fuera, que se ve la otra foto a distancia, para ver la comparativa de una colmena con abejas y en el exterior.
Okay, muy bien. Very interesting. They made the measurements, these people, these scientists from the university, not only in the beehive here, but also outside. As you can see, these are the device, the same kind of device. It's also here outside, the distance from the apiary. So they analyzed the concentration of these volatiles in this area.
Y hay algunas concentraciones 300 veces superiores dentro de la colmena que fuera, en los terpenos sobre todo.
Okay, so what they saw that some substances from beehive air are like 100 times more concentrated here than outside. One such class of substances which was much more concentrated than outside were the terpenes. Okay, muy bien.
Y aquí miremos a ver si era perjudicial estar todo el día dentro de la casa atendiendo a los pacientes, y vimos que aunque estuviéramos 8 horas respirando ese aire no sería perjudicial para la salud.
Okay, so this is another very, very important observation. This university from Catalonia, Polytechnic Catalonia in Barcelona, they wanted to see if staying in the bee house for 8 hours, you see here, 8 horas, for 8 hours, can be damaging for the health of the people. So they saw that it's absolutely no problem with this, because in the bee house, there are no toxic components or carcinogen components, if the bee house is well done. So it's no problem with the health of the patients. Very good. Okay.
Bueno, esta no se ve bien, pero aquí venía a referirnos de los compuestos volátiles, que viene a ser como el WhatsApp de las personas. Los árboles se comunican con los compuestos volátiles que nosotros inhalamos también y son muy beneficiosos para la salud.
Okay. Disculpe por esta problema técnica. Sorry for this technical problem. The idea from Samuel was here that we can, the components from the trees, they are coming to the bees, and from the bees to us.
Y estos compuestos también pasan a los mamíferos. Hay estudios.
Okay, and these components, of course, from the trees, they go also to the mammifers, to the mammals, to other animals which are surrounding the bee colonies. Okay, so here are a few words about the terpenes, how they are working from the plants and how they influence the insects, the mammals, the fungi, the microorganisms. It's a whole universe here of the communication between the plants. And then here an example of Pilen as a terpene. Okay, sorry, Beate, maybe. Okay.
Yeah, it's sorted.
Yes, thank you. And here about some properties of these terpenes, and Tiago already spoke about this. Like one of the effects is that terpenes can reduce the melanomas with a 40% volume or ratio. Okay, and it's also bronchodilatory and expectorant. Okay, and it's good for these properties. Okay, sauna of the bees, one other concept. Here the beehives, they create a heat, they make micro vibrations, they release like negative ions in the beehives inside. There is also aura of the bees, as we talked about a bit before, and the sound of the bees, the bee zoom, which has different intensities and frequencies and so on. It's another topic, very interesting. And of course, different aromas. So inside just a big house like this one, you can get all these things, plus the therapeutical effects, of course. Okay. Okay, so here is a bit of explanation of how the bees are breathing through their like nostrils. They have several nostrils than us. Okay, so okay, and then here about sleeping in the beehive. Some properties, some effects which were measured in the beehive was regulates the blood pressure. And then the cholesterol, it release, diminish the stress, calms the nervous system, improves the well-being. It improves the equilibrium between the two hemispheres of the brain, normalizes the sleep, helps to eliminate the toxins from the body, increases the energy of the body, helps to decrease the body weight for those which are having overweight, improves the function of the digestive tract, improves the circulatory system. Okay, and here again, some things which are very interesting also for Tiago, for our scientists, how these substances are helping against asthma, for example, ethyl nitrite, and then nitroglycerin, which may be also present, can have this antispastic effect, and also against epilepsy. So it was a question from somebody before, if we can use the Beehive Air against epilepsy, and we'll speak about the contraindications later. And also there are components like these carboxylic acids, which are antimicrobial. And we saw a presentation from Egypt about this. Okay, so another topic, very, very interesting. And Samuel is really an expert in this topic because Samuel was also a very good sportsman. And he works with a lot of sport people in Barcelona area in Spain. Okay, so he noticed that using AP therapy, including Beehive Air Therapy, improves the strength of the condition of the sport people. And here are some testimonials of people about Beehive Air.
Hola, estamos aquí con Oliver, que el año pasado hizo un tratamiento con aire de colmena y nos va a explicar su experiencia.
Igual se podría poner el subtítulo, ¿no?
Fui muy rápido. Yo empecé a hacer el año pasado, no cada día, venía una vez al mes, procuraba venir una vez al mes. Y el resultado es que yo había tenido un pequeño accidente pulmonario hace 3 años y había bajado de capacidad pulmonario a 64%. Y mi objetivo estaba recuperar esta capacidad pulmonaria. Los médicos no me habían dado ninguna solución, excepto bajar pesos, hacer deporte, cosas de ese estilo. Y la sorpresa es cuando me presentó al médico el año pasado, me dice, ¿qué has hecho tú? Porque cuando veía los resultados, he pasado 87, de 64 a 87%. Él no me creía. Eso le he explicado, he ido a respirar las colmenas. Ya que es esta historia, ha hecho venir, había alumnos a su alrededor. Dice, no, hemos oído hablar, vez venía con una botella de aire y las 3 o 4 últimas veces que venía con su hijo y no tenía la botella de aire. La cosa es que yo tengo los resultados de un médico de análisis y no he hecho absolutamente nada más que venir a respirar una vez al mes y sí, coger propolis cada día, 20 gotas por la mañana, 20 gotas por la noche, todo el año. Esas son las únicas cosas que he hecho, gracias a las abejas. Y gracias a
Gracias. Tony López, que ya tiene experiencia con las pruebas de aire de colmena y nos gustaría que nos explicaras tu experiencia.
Hola, pues yo soy Tony, soy asmática desde bien chiquitita. Siempre había estado temporadas de primavera y de otoño en hospitales y me hablaron de esto y decidí probarlo porque estaba harta de medicaciones y de cortisonas.
So this lady was in hospital many times. She was using a lot of cortisons.
En invierno apenas me resfrío cuando yo cogía unas anginas por mes. Apenas cojo bronquitis. Yo salgo a bailar los fines de semana, ya no necesito Ventolin, cosa que nadie se cree. Y es verdad, siempre se lleva mi Ventolin puesto. Y yo lo recomiendo. Yo recomiendo que por probar no se pierde nada y se gana mucho.
Con Gabino Palomo, que es un paciente que ha ido viniendo a respirar el aire de las colmenas y se ha hecho unas pruebas médicas y hemos visto que ha pasado del 45% de capacidad pulmonar al 65%.
Okay, so here Samuel was saying that this patient was going from lung capacity 45% to 75% after Beehive Air Therapy.
y él nos va a explicar un poco su caso, cómo le ha ido y cómo está a día de hoy.
Bueno, yo
Si quieres, quítate.
la verdad es que me encuentro bien, me encuentro con más ánimo y claro, cuando una persona ve que va recuperando capacidad y más en mi situación, pues te anima y te da más ganas de salir y, en fin, me encuentro mejor bastante.
Okay, so he just said that he's improved in the energy tonus, the quality of life, and after using the Beehive Air Therapy.
Y contento, pues claro, de tener un 45% que apenas daba 2 pasos, me tenía que parar, hoy que a lo mejor me hago 3 o 4 kilómetros y no tengo que pararme nada, pues claro, para mí...
Before he was not able to walk only short distances, and now he's able to walk like 3 to 4 kilometers.
Es una satisfacción grande, ¿no? Y todo a consecuencia de esto de las abejitas.
Porque explícanos un poco tu caso, qué te pasó y desde cuándo y eso.
Bueno, mi caso es que caí enfermo de cáncer.
He was suffering of cancer.
Y entonces me tuvieron que quitar un pulmón. Y claro, pues al quitarme el pulmón, pues entonces bajé un montón de capacidad.
So the doctors were forced to take out one of his lungs through surgery because of the cancer.
Y me he tirado unos pocos de años bajando, hasta que en el 2000 conocí a Samuel y probamos con esto y me ha ido bastante bien. No es un milagro porque en mí ya no caben los milagros, pero me encuentro mucho mejor.
Then he has had the chance to know Samuel, to meet Samuel, and it was like a miracle because now he's much better.
Pero una cosa que a mí me ha llamado mucho la atención es que él, después de la operación y de hacer sus clases de recuperación, llegó a un 65% de capacidad pulmonar en el año 2000, ¿no?
Sí, correcto.
Y entonces en estos 20 años ha ido bajando al 45%, ha ido bajando su capacidad pulmonar. Y él empezó el año pasado a respirar, hizo a lo mejor 15 o 20 sesiones,
sí.
Y este año, ¿y cuántas llevaremos?
Este año un poco más, porque como estoy viniendo 2 veces en
a
semana,
a lo mejor llevarás 10 o 15 sesiones más.
Sí, o 20 como máximo,
vale.
20.
Y entonces ayer hizo la prueba en el médico con los mismos aparatos y ha visto que tiene otra vez el 65. O sea...
Okay, so the patient at the beginning was having normal lung capacity. Then because of the cancer, the lung capacity went down to 45%. Then he did some treatments with the lung specialists in Spain there. So he went from 45 to about 65%. Then the disease was again worse. It went back to 45%. Then after about 15-20 sessions with the Beehive Air, his lung capacity went back to 75%.
En 20 años perdió un 20 y ahora en un año o dos ha recuperado un 20.
Un 20,
sí, eso es lo que a mí me llama.
Okay, so when he was ill, he lost like 20%. In 20 years, because of the disease, he lost 20% of his lung capacity. And then when he started with Beehive Air, he made several sessions during 1 year. He recovered in only 1 year, 20% of the lung capacity.
Estoy en el nivel máximo que pude alcanzar cuando estaba haciendo la fisioterapia de la recuperación del pulmón, digamos.
¿Y esto por qué funciona? Porque aquí hay muchísimos compuestos volátiles que son de las plantas, muy beneficiosos para nosotros, y nosotros los inhalamos con este sistema. Aquí tenemos las colmenas, que están las abejas trabajando con su propóleo, su miel y sus productos, se evaporan y pasan a través del tubo y lo respiramos aquí durante media hora.
Okay. So Samuel was explaining shortly how it works, the system. The bees are getting from outside the volatile components, from the herbs, aromatic plants, and so on. And then the air goes up through this special system here, through the tube, and arises to the patient.
Aquí tenemos las pruebas de la espirometría que hacemos aquí. Lo que pasa es que ahora se ha apagado.
Bueno,
da igual.
No, dale. Espera, presentamos y no pasa nada.
Okay, now
Nosotros hemos hecho durante todas las sesiones, hemos ido haciendo una espirometría para ver la evolución, ¿no? Y hemos visto que durante ese tiempo ha ido siempre
Ahí lo tienes ahora.
subiendo.
Okay, so here in this image is the lung capacity measured in time. So you see here was 211, and then it was increasing. Here was a very good 308 on 11 June. And here it's a bit lower, but it's still much better than this one.
Él empezó aquí y fue subiendo.
Okay, so started 219 and then the capacity
hasta aquí.
increased. Step
Y
by
bueno,
step.
y seguiremos haciendo y seguiremos viendo a ver hasta qué nivel podemos llegar.
Con mantenerme en el que estoy ya me doy por contento.
Okay, so it's true that his lung capacity is not like 100%, but it's good enough to be able to walk, to have his normal life.
¿Vale? Pues venga, que vaya muy bien.